So the potential side effects of this treatment are in order of frequency would be, first of all, fatigue, and a whole range of fatigue, but generally fatigue is quite mild, and people continue on most of their normal life activities on this. We do know that people who have a lot of other medical issues, in addition to their melanoma, tend to struggle more with fatigue because it results of the combination of their other medical illnesses um, and the immunotherapy. So patients, for example, patients who have heart disease or who have a diabetes or uncontrolled hypertension or kidney or liver dysfunction, these patients tend to have more fatigue than those who do not have those concurrent illnesses. Another common side effect is rash. Again, it tends to be unpredictable in who gets it and who does not. It can sometimes be associated with itchiness. Sometimes people get itchiness without any rash at all. It tends to come and go, but it is also very amenable to a number of skin treatments. We also know that patients who keep their skin well moisturized and stay out of the sun are less likely to develop severe forms of the rash than those who do not. Other common side effects that we monitor while they're going through treatment is it can affect the thyroid function. It can cause the thyroid to become inactive or low, as activity, it produces less thyroid hormone. And that's something that we pick up in blood work. And the other can affect the liver and cause inflammation of the liver. And early signs of that are also picked up in blood work, generally well before the patients are aware that something is going wrong. But it's part of our routine monitoring these patients. Another uncommon but important side effect is development of colitis, which is basically inflammation of the bowel. This can be manifested itself by a severe diarrhea. If that occurs, it's important to identify it early and start on the appropriate treatment as soon as possible. Generally, it's something that we can countervene and intervene in a successful way. Rarely it does cause long-term bowel injury, and this is a uncommon but severe side effect of immunotherapy. Rare side effects include the development of insulin-dependent diabetes. This occurs when the immunotherapy results in the pancreas no longer being able to produce insulin. And if that occurs, the patients need to be on insulin for the rest of their lives. It's rare that the insulin production is recovered. And so this can have a life-altering effect on patients if they develop diabetes on treatment. It occurs in 1% to 2% of patients, but is a real side effect that we certainly look for. Other rare but important side effects, it can affect the production of hormones from the pituitary gland and the adrenal gland. And this can be counterbalanced by providing supplemental hormones, but usually it's lifetime requirement of hormone supplementation if those organs are affected. And rarely it can cause inflammation of the lungs and cause breathing problems. There are treatments for this, but it can result in some long-term lung damage. And even more serious is if it causes inflammation of the heart muscle. This can lead to heart dysfunction, which can be severe and again life-threatening if it occurs. Both the pneumonitis and heart effects are rare, but if they occur, they need to be treated and hopefully reduced before they have longer-term effects.